Well, hello everybody. So we're in conversation again, talking about the work of ABHI's member groups. And today we're talking all things spinal with Kate Windard, who is the chair of ABHI Spinal Group and the commercial manager for NuVasive in the UK. Kate, thanks so much for joining us. Let's start with the way I always start. People are interested. Just tell us a bit about your background and how it's relevant to the role you have leading this group for us.
Good morning, Richard. Thank you so much for giving me the opportunity to speak to you and the members this morning. Yeah, I've had quite a varied past, I suppose, is the best way to put it. I actually started out doing an animal science degree, and as actually was going to continue down the path of veterinary medicine. Unfortunately, a family bereavement, close family bereavement, meant that I needed to get a job. As an interim, was supposed to be sort of taking a year out and get a job, but actually found my path into pharmaceuticals, funnily enough. And then once you start earning money, I never went back. And I worked in pharmaceuticals for a couple of companies. 3M was predominantly the first and where I really learnt my ropes. Way back, and was with them for about 6 years, and then came into devices actually from there on in, and I've been very fortunate that I've always worked in spine in devices ever since then, and worked for a couple of different companies. Luckily never sort of competed with myself, but always had to slightly varied, but also been able to gain a broader sense of the industry itself. And certainly, when I first started in spine, there wasn't so many reps that there are today, and it was a very different marketplace that it is today. But and certainly with the advancements and the innovation that's around now, it's grown significantly. So it's a very exciting sector to be involved with.
Great, thanks, Kate. I think that is your path is a fairly well trodden one into our industry, isn't it? It reminds me very much of my own transition from pharmaceuticals back to the very early days of interventional cardiology. So, Kate, just tell us a little bit about the world of spine and the offering of products and services our members have in the space.
Yeah, so the world of spine. So we're dealing with spinal clinical surgeons that essentially deal with any pathology from sort of skull base right down to the sacrum. That could be for a patient that is sort of younger, so born with degenerative or deformities through scoliosis, can be early onset, or obviously then late onset, then through to tumor trauma. So it could be someone involved in a collision, and there's various different fractures that can occur in the spine, and through to sort of adult, and where you see much more wear and tear or degenerative progression on the spine, and where patients then find themselves becoming more kyphotic or lots of back pain, and that's when a spinal surgeon would need to have some sort of interventions. And then in terms of where have we seen, we've gone sort of very much from sort of wire based and sort of hooks through to pedicle screws, through to now tethering sort of anteriorly for different techniques. There's a huge amount of innovation, and I certainly think there's still a lot more innovation to come in spine.
That's great, Kate. That's really interesting. So finally then, just maybe tell us a little about the group, some of your priorities and what we might expect to see from you in the months ahead.
Yeah, the Spinal Group, we're very much focused looking at obviously the patient and getting best outcome for the patient is the foremost for us as a group, but equally and partnering with our clinicians that we work with to make sure that as a collaborative, we're working towards the same goal, to not only help them improve for teaching, for training, but also to make sure that innovation is working in the right direction that is aligned to clinicians' thinkings, and also making sure that obviously from a registry point of view that procedures are recorded, so that we can track and monitor to see how procedures are doing, and as I say from the outset, it's about improving patients' outcomes. is especially important for us. And where we're kind of moving to next is we're creating subsectors within our own group that then can have a clear focus, because often it's quite difficult for myself and the chair, Anthony, to then focus on all of these different activities. So it's trying to get that clear engagement from the group, so everyone has like a subsection that they then report to, so that when we come back together, we've got far more engagement and actually proactively moving things forward.
That's great. That's really interesting, Kay. I mean, it highlights your earlier point, doesn't it, about how the industry has burgeoned and blossomed and has gone into ever more innovative areas. I actually remember this group starting as a splinter from the orthopedic group because it was looking very specialist at the time. Kay, that's been fascinating. I'm sure our members will enjoy hearing that. It just leaves me to thank you so much for giving of your time and your leadership in this group, and we look forward to seeing great things in the months ahead.
Fantastic. Thank you, Richard.